My next guest has also not been on with me. We are live on Facebook, so hi to everybody out there. Like us and follow us. I have with me Dr. Pinedo, and he is the owner of Southwest Foot Institute. Welcome to the show. I want you to talk a little bit about yourself, and how you got a big passion of this, and then a little bit about what we're going to talk about today.
Absolutely, Carol. Thanks for having me on the show today. Yeah, my name's Dr. Ryan Pinedo. I originally come from Utah. I'm a board-certified podiatric foot and ankle physician. I really treat everything foot and ankle, skin to bone, everything from trauma, hammer toes, bunions, all the way to diabetic foot care, and I really have a passion with this. It took me a long time to kind of figure out what I want to do, but the second I shadowed a podiatrist, I was sold on this. Most people walk out of the door feeling better than when they came in, and my journey's kind of brought me full circle. From I did my schooling down here in Arizona, Utah training. I was in Texas for a long time. And then it's brought me back to Arizona, where I purchased a practice that's been here for a long time. And I'm here today to talk more about diabetic foot care and what we can do about that.
We're going to open up the lines of the audience for everyone to get entered and to win a custom pair of orthotics. It's a $500 value, free to you or anyone that you know. You got to visit the office, but here's what we're going to do. We're going to have them call in here for it, okay? That's how I like to do it. So our number here is 602-277-5369, and toll free it's 1-866-536-1100. You're getting entered into win. Now, custom orthotics are a lot different than Scholl's, Dr. Scholl's, right? Totally different. Tell them a little bit about them.
Correct. A custom orthotic is actually a prescription device for your foot, whereas any off-the-counter brand or whatnot will be made for certain things, but it doesn't work for everybody. A custom orthotic, we actually use a device that scans your foot. It shows us where all the bony prominences are, and I do a custom prescription for every pair, and that gets sent to a lab, and they make it exactly how I want. So it is made for your foot.
That number to call here, 602-277-5369, and toll free it's 1-866-536-1100. You have two Valley locations, Glendale and Phoenix. Their website is Southwest, it's all spelled out, southwestfootinstitute.com. They also are on Facebook there as well. You could check them out. Their phone number, write it down, because you know what? Our feet are killing us. The summer is upon us. You're going to be barefoot. You're going to mess up your feet. So you might as well have the number in your book. It's 602-340-8686. And then call in here, get entered into win a custom pair of orthotics, 602-277-5369. Why is it important for diabetics to see a podiatrist?
Absolutely. Well, diabetics have a lot of foot issues that make them high risk for wounds, infections that unfortunately can lead to bad things such as amputations. And the biggest things that we look at are deformities of the foot, blood flow issues, as well as neuropathy. And the deformities make it so shoes rub on your feet. Blood flow issues make it so that you don't heal those things, and neuropathy, you can't feel those things. So when you wear a pair of shoes, people who have sensation, they'll look at that area, they'll take the shoe off, evaluate it, where diabetics just don't have that. So the nice thing with our clinic is we have x-ray in our clinic where I can look at the deformities. I can walk people through what type of shoes to get and what to look for. We also have testing for blood flow where we can non-invasively do that. Our tests take anywhere from about 60 to 90 seconds, and I have immediate results, and I know whether I need to send you to a vascular surgeon or not. Plus, we have diagnosis for peripheral neuropathy as well. So we cover all three of those things. And if we can get those under control, the big goal with diabetics is all about prevention.
Right.
If we can prevent things from happening, people can keep their limbs essentially, because diabetics do lose limbs. And so we're all about prevention, but we're about treating when those things do happen.
So, a lot of people don't even know if they have neuropathy or not. And how do they tell? What are some of the symptoms?
Yeah, so the symptoms vary between patients. A lot will say tingling, burning, mainly in their toes. And it's going to be both sides. If it's one side, it likely is something else. But if it's both sides, tingling, burning, numbness, heavy feeling. Can also be, my feet feel cold at night, but when I touch them, they feel warm. Those are all symptoms of neuropathy, but that just kind of hits the, the tip of the iceberg as to what you can feel. Yeah.
And here's the thing, though. If you or someone that that's what I love about this show. It could be you, or it could be someone that Right. Tell them about this. It's so important that they take care of themselves and to be proactive about their health in every way, right?
Correct.
That phone number to call is 602-340-8686. The website is Southwest. It's all spelled out, footinstitute.com. You can also see them on Facebook as well. You basically treat the whole family as well. I mean, not just just older folks. Anybody can come?
Absolutely. Anybody can come. I spent a lot of time in Texas, and one of my colleagues there, one of my partners, he is one of the leaders in the country with pediatric flat foot surgery and even non-operative treatments. So I was able to learn from him, and I've brought those things to Arizona. I love to treat children in regards to their foot issues, everything from ingrown toenails to flat feet to bunions. I mean, you name it.
But a lot of our older folks that deal with this, and we just do. The summer is upon us, right?
Correct.
Okay. And so people are thinking, okay, I'm going to have an orthotic. Can an orthotic go into any shoe, or does it have to be a closed shoe, or how does that work?
That's a great question. And orthotics are made for closed-toed shoes. Typically a walking shoe, a running shoe. They usually don't fit into, business shoes, obviously sandals. Now, I do have a lot of patients that wear them in their Crocs, which are great. So if we can get a patient to even wear their orthotics for 4 to 6 hours a day, they can be in those sandals and even barefoot throughout the day. Absolutely.
We've got everybody that's getting into Win. It's a pair of, they're actually custom-made orthotics. So this is a $500 value free to you or someone that you know. So call in here, 602-277-5369. They've got 2 locations. One is in Glendale. The other one is in Phoenix. I want to talk a little bit about the laser therapy that you use.
Yes, the laser therapy is a fantastic modality that we have, and the laser therapy can be used for everything from acute injuries to chronic pain. I also use it a lot for my post-operative patients. So this really fits in with the population that does not want surgery on things. Everything from arthritis to sprains, strains. This laser therapy, it is FDA approved, and it can be used to treat these things. And the majority of my patients who use it, I'll be honest, they're a little skeptical at first, but most by the time they're done say, I'm so happy that I use that because it prevents a lot of surgeries.
No downtime?
There's absolutely no downtime for it.
Which is huge for people, right?
Yep, and the treatments take about 8 to 12 minutes at a time.
That's great.
Absolutely.
I want to talk about, you say that you talk about your practice as a sports, it's more like also for sports medicine. Why do you say that?
Yeah, so I definitely treat a lot of sports injuries, from ankle sprains to sprains, strains, ankle pain. Just really everything. And we have lots of options from the laser therapy to injection therapy, all the way up to surgical options if we need to. I also work very, very closely with a few physical therapy groups that are very, very good to getting young athletes, your weekend warriors, back to doing the things that they want. So we have lots of ways that we can help these people.
And you also do surgery?
Absolutely.
Where do you do those? Where do you perform them, in the office?
I perform very, very minor procedures in the office. I also work at a surgery center and several hospitals. So,
and here's the thing, though. People with our feet, we have hard trouble with our feet. Most of us, especially, like I said, our old folk. You see most commonly in your practice what?
Probably heel pain, be completely honest with you.
Not bunions. I would have thought bunions and ingrown toenails or something like that.
Those definitely rank up there, but heel pain, you look at it nationwide, heel pain is the number reason people come to see a podiatrist.
Do you think that the diabetes, and we were talking about neuropathy and all of that, do you feel like it's still on the rise? Is it getting any better? Are we getting any better at our diets, or what's happening in your world?
Yeah, there's no question that diabetes and neuropathy and vascular disease are worsening, and every year they come out with statistics and studies to prove this. And so it is definitely still a concern that we need to address. Everything from working with primary care physicians to podiatrists to really everybody. So.
Yeah, and in terms of with what you do, you've got these 2 Valley locations, which is nice that you offer that. And I want people to understand that. What does it look like when they call you, and let's say they're dealing with something that is chronic foot pain, whether it's heel pain or an ingrown toenail that just doesn't go away?
Yeah. Well, the first thing you're going to notice is we have fantastic staff at our offices. So you're always going to, when you call in, you're going to be met with a very happy voice. They're going to get you an appointment. They come in. We have everything from x-ray to ultrasound to the examination I perform to figure out what we need to do for that. And really the options are pretty endless, honestly.
A lot of people like to call Dr. Google.
Correct.
Right? And so I want to ask your thoughts on that, especially when it comes to, let's say, somebody has, they look it up. They look up neuropathy, or they look up the toenail or fungus or whatever, and they try and treat these things on their own. What are your thoughts about that?
So my biggest thought on that are my diabetics who try and treat themselves based on what they see on Google. Those are typically the patients that come in down the road when we could have treated something small that end up with the unfortunate things such as amputations and whatnot. So for a diabetic, I would say don't go off of what you read. See a professional.
Absolutely. You must see a professional, anybody who's dealing with especially diabetes and anything. Right. I always say don't try and do these things on your own.
Right.
They have 2 locations. They've made it convenient for you. Go in and check them out. Also, you can get entered into win here. It's a pair of, well, these are custom-made orthotics, so that's different. You can't get those anywhere. These are specialized, made for you or anyone you know. It's a $500 value, free to you or anyone that you know. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Check them out on their website. It's Southwest. It's all spelled out, southwestfootinstitute.com, or you can call them direct at 602-340-8686, or call in here and get entered into win.
If I traded it all, if I could.
The information and opinions